Welcome to this educational program. This module provides general information about hematuria, or blood in the urine. This presentation is written by specialists in this field and is independently produced. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Hematuria is a clinical term meaning blood in the urine. Hematuria may be a sign that there is something abnormal in the kidney or anywhere along the urinary tract from the start of the kidney drainage system to the end of the urine channel or urethra. The presence of any blood in the urine should always be taken seriously and investigated quickly. The urinary system begins at the kidneys, which are fist-sized organs located in the flanks. These are vital structures with many important roles, including filtering waste products out of the blood and producing urine. The kidneys are composed of many different types of tissues and cells. Essentially, they consist of a filtering system, the meaty red part of the kidney, also called the parenchyma, and a drainage system that carries urine from the kidney down to the bladder. Urine flows out of the kidney into a long, narrow tube called the ureter and down to the bladder where it is stored. Urine is emptied during urination and travels out of the body through the urethra or urine channel. The female urethra is short and straight, while the male urethra is longer, angulated, and surrounded in part by the prostate gland. Hematuria may be classified as microscopic, meaning that it can only be seen when the urine is looked at under the microscope, or gross, meaning that it can be seen with the naked eye. Microscopic hematuria does not always indicate an underlying serious problem, and when and how to evaluate it depends on the clinical situation. It is recommended that patients over 40 years old and those with certain risk factors for significant disease receive full evaluation. Anyone with gross hematuria, meaning blood in the urine that they can see with the naked eye, should be evaluated by a doctor as soon as possible. Risk factors for having significant disease in the urinary tract include smoking, exposure to certain chemicals or dyes, previous urinary problems, significant urinary symptoms, heavy use of certain medications, especially one called phenacetin, radiation to the pelvic area, and treatment with a chemotherapy drug called cyclophosphamide. There are numerous possible causes of hematuria, ranging from minor to life-threatening. Some minor causes include things such as runners or exercise hematuria, cysts in the kidney, mild inflammation, prostate bleeding, polyps, and dilated blood vessels in the bladder. More concerning causes of blood in the urine include stones in the kidney or the bladder, blockage of the urinary tract, minor trauma, blood disorders such as sickle cell anemia, medical kidney diseases, drug reactions, infections, which may be viral, bacterial, fungal, or STDs, and more severe inflammation. Finally, some potentially life-threatening conditions include trauma or injury to the urinary system and cancer of the kidney, ureter, bladder, prostate, urethra, and other organs. If you have blood in the urine, you should see a doctor and have a proper evaluation. At a minimum, this includes a medical interview, physical exam, and some basic lab tests. More specialized lab tests may be required, as may imaging of the urinary tracts, such as an X-ray, ultrasound, or CT scan. Referral to a specialist is often required, and these doctors may do more advanced testing to make the final diagnosis. The evaluation of hematuria begins with a focused medical interview, or history. The aim of the interview is to find clues as to the cause and significance of the condition. Questions will be asked about related urinary symptoms, general medical symptoms, and other medical conditions you may have, current medications, and any allergies you may have. A social history is also very important, especially regarding smoking habits and exposure to possible toxic substances. Finally, a family history of kidney or urinary tract conditions can be important. The interview and other investigations allow your doctor to classify the hematuria and focus his or her investigations. For example, is the hematuria real or is the urine just stained, called pseudohematuria? Is it painless or is there pain in the abdomen or with urination? Are there associated urinary or other symptoms? Is it microscopic or gross hematuria? If gross, is blood seen at the beginning of the stream, called initial hematuria, through the whole stream, called total hematuria, or only at the end of the stream, called terminal hematuria? Some foods can stain the urine red when there are no actual blood cells in the urine. This is called pseudohematuria. Such foods include beets, berries, food coloring, and certain laxatives and pain medications. Having said this, never assume that red urine is normal for you. You should speak to your doctor about it and have the urine checked at the very least. Other important symptoms that may be associated with blood in the urine include painful urination, more frequent or urgent urination, difficulty emptying the bladder, fever, weight loss, and swelling. Many important conditions, however, have no associated symptoms, and hematuria may be their first warning sign. A physical examination will be performed as part of the investigation of hematuria. This examination includes an assessment of blood pressure and pulses, a general medical exam, an abdominal exam, and a pelvic or rectal examination. Lab testing usually begins with simple urine testing, such as a dip test, which can be done in the office. In this, a special strip of paper is dipped into the urine. If the urine contains blood, it will react with a chemical coating the paper to change its color. If the dip is positive, the urine will require inspection under a microscope. If blood cells are found, the test may be repeated at a later date to confirm the significance, depending on the situation. When the presence of blood is confirmed, special urine tests are sometimes performed, again depending on the situation. These may include urine cultures to rule out infection, 24-hour urine collections when kidney disorders are suspected, or urine cytology to rule out cancer of the urinary tract. Urine cytology involves the careful inspection of the urine to look for abnormal tumor cells. New tests are also available which can detect markers of certain tumors in the urine. These are not utilized by all doctors and have not yet become standard screening tools. Blood tests, such as kidney function testing or a PSA test for the prostate, may also be requested. Often included in the workup of hematuria is ultrasound, which uses high-frequency sound waves to produce images of the inside of one's body. For a renal or kidney ultrasound, something called a transducer is moved across your abdomen and flank to show a picture of its contents. In particular, your kidneys and bladder are evaluated closely. An intravenous pyelogram, or IVP, is a special X-ray to evaluate the kidneys and urinary tracts. Contrast, commonly called dye, is first injected into a vein, then a series of X-rays is taken as the dye filters through the kidneys and down the urinary tract. This usually takes about 30 minutes. Prior to having such an X-ray, it is important to notify your doctor if you have an allergy to dye or to shellfish, as allergic reactions to the intravenous contrast can be serious. A computerized tomography or CT scan of the abdomen and kidneys is sometimes performed to evaluate blood in the urine. This gives a more detailed look at the contents of the abdomen than X-ray or ultrasound. Contrast, or dye, again may be given to improve the view of the urinary tracts. Depending on the results of all these investigations, referral to a specialist, as mentioned previously, may be necessary. A nephrologist is an internal medicine specialist or internist who specializes in medical diseases of the kidney. A urologist is a surgeon who specializes in surgical conditions of the kidney and urinary tracts. Cystoscopy involves the passage of a narrow telescope through the urethra into the bladder. You and your doctor can view the anatomy on a video monitor. It is usually a very quick outpatient procedure, and it is the best way to view the lining of the bladder and urethra. To make this examination more comfortable, freezing jelly is passed into the urine channel to numb the lining of the urethra. With this given, one should feel only minor discomfort at worst. In men, cystoscopy involves the passage of a small flexible telescope into the bladder with the patient lying down. A rectal examination to feel the prostate is commonly performed afterwards as part of the assessment. Women have a shorter, straighter urethra, so a small straight telescope may be used, with the patient's legs up in stirrups. A pelvic exam, if not done already, may be included in this visit. Occasionally, at the time of cystoscopy, a retrograde pyelogram will be required. This is an excellent method of looking at the ureter and drainage system of the kidney. For this test, with the cystoscope in place, a small tube is passed into the ureter and contrast is injected through the tube up into the ureter and kidney drainage system. For this test, with the cystoscope in place, a small tube is passed into the ureter and contrast is injected through the tube up into the ureter and kidney drainage system. X-ray films are taken while this is being done. Hematuria is a common clinical condition, with about 1 to 20% of the population found at some point to have blood in their urine. With a full evaluation, a cause will be found in somewhere between 32 and 100% of patients. The chance of cancer is very low in patients younger than 40 with no risk factors. It's less than 1%. However, with risk factors and over the age of 40, the chance of cancer may be as high as 11%. These statistics have led to the development of guidelines in most developed countries for the evaluation of hematuria. If an abnormality is found, your doctor will review the findings with you and direct treatment according to the diagnosis. With all the different possible reasons to have blood in the urine, the possibilities of treatments are far too broad to go into in this presentation. Many patients are surprised when nothing is found after all investigations have been completed. There are, in fact, many possible explanations for this occurrence. These may include a benign condition, such as runner's hematuria, an infection that has passed, a tiny kidney stone that may have passed, mild inflammation, a few blood cells filtering through the kidney, or weak blood vessels on the surface of the bladder or prostate. Often one will never know what the exact cause was. Some patients have a small amount of blood in their urine that persists on multiple urine tests over many years. Usually, as long as you do not have any significant risk factors for urinary disease, this does not imply serious underlying problems. However, your doctor may choose to repeat testing every several years or so just to be sure, even if you are otherwise okay. Further investigation may also be required if there are other signs of kidney disease, if there is worsening microhematuria or development of gross hematuria, or if pain or other significant symptoms persist. In summary, hematuria is a clinical condition describing blood in the urine. It may be the first sign of problems with the kidney or urinary tract. Evaluation of hematuria often requires referral to a specialist, imaging of the kidneys and urinary tracts, such as with ultrasound, IVP, or CT scan, and special tests such as cystoscopy. This testing is critical to diagnose important treatable conditions. Blood in the urine should always be taken seriously and investigated quickly and thoroughly. This is just a sample of modern references discussing hematuria in more detail. They are available for you to review through the internet or your local medical library should you wish to do more reading on this subject. We sincerely hope that this presentation has furthered your understanding of hematuria. If you have seen blood in your urine or have been told that microscopic blood has been seen on urine testing, please contact your doctor or the doctor who has sponsored this presentation. Other modules are available through your doctor's office